So for all those 55-year-olds out there, is healthcare really going to cost you over $1 million in retirement?
The answer could be yes, Shannon. For those higher income retirees, over $160,000 in income, it very well could cost that, especially if we estimate that you're going to live out to age 90.
In a lot of our videos, we talk about the increasing expenses of healthcare and retirement, what a huge problem it is for a lot of people, and really let's drill down into those details so you can figure out exactly what it's going to cost you to retire and to buy Medicare.
That's right. So we're using a report from Avante, which is a local company here in Colorado that produces a couple of different reports, but they do one that they use with financial advisors to help individuals figure out or forecast what their healthcare costs are going to be in retirement.
Absolutely. We actually met through Avante and we got to talking, and once we started really looking at these numbers, we decided we got to let people know that this is something that they should expect and let them know before it's too late to plan.
Yeah, so when we break this down into what those costs are, so how do we get to $1 million? Well, we start with Part B of Medicare, because that's the part where you have to pay a portion of the premium for that coverage. And if you happen to be that higher income earner, you end up paying about 80% of the premium that's forecast that's calculated each year by Medicare.
Today, you probably pay the same as your neighbor for the same healthcare coverage. Well, once you turn 65 and start taking Medicare, it all changes, and it really depends on your income. And then on top of the Part B and Part D premiums that are means tested, that's for the majority of Americans not enough coverage, and you're going to have crazy out-of-pocket expenses if you don't have some other type of Medicare to go hand in hand with kind of the base level plans.
That's right. So Part A and B both have out-of-pocket costs that are not covered. So as Shannon said, you're going to be having to look at either a Medicare supplement or a Medicare Advantage plan to help offset what those costs. And then Part D, which is the prescription drug coverage, also has costs that you end up paying out of pocket. So when we're talking about all of these costs, we're factoring those into it too. One thing with Part D prescription drugs that a lot of people don't realize is that those plans, in most cases, once you hit their maximums, they still have 5% that you may have to pay for drugs ongoing. And we've seen recently some employees who are retiring and had some very expensive drugs they were taking, where they could be paying $500 to $1,000 a month out of pocket for their prescription drugs, which is really, not something that most people are factoring in when they're thinking about those costs.
Right. And in some cases, there are generic alternatives, but in others, there aren't. And you need the drugs that you need. So.
That's exactly right. So again, when we look at the costs, we're looking at Part B, Part D, premiums, as well as then those supplemental charges that are there. Some other areas that people forget about, dental.
Yeah.
As we get age, our teeth start to break down. So there's a lot of costs for implants for people who are retirees, also just all sorts of different dental work that needs to be done. And that's something a lot of people don't realize or think about when they're budgeting and creating plans. So that's another area that gets included in this. And then things like hearing aids or vision costs. Those are other costs that are typically out of pocket and not covered by insurance. Yeah,
and the older we get, the more dental work, the more vision costs we might incur. And again, hearing aids, that's a really common thing that people always assume is covered by Medicare. And for the most part, it's not.
Yeah.
So the last component that we do want you to be aware of is long-term care, because long-term care is not covered by health insurance. It's not covered by Medicare. And as you might know, those costs can be very, very large. I think last year, the average cost for a year in a long-term care facility was around $100,000, and those costs continue to increase year over year. And not everybody at that time in life, if they have long-term care needs, not everybody wants to end up in a nursing home. So if you're looking at in-home care or adult daycare. There are lots of different costs that can occur if you need them down the road, and they're only getting more expensive.
So let's circle back a little bit. So how do we get to $1 million? How does that happen? So if we take a 55-year-old, we assume they retire at age 65, and then we use age 90 as their mortality date. So that's basically 25 years in retirement that they'll be paying for these healthcare costs. And again, remember that we're also talking about somebody in a higher income bracket, so they're paying that Medicare means testing. Well, those premiums under Medicare and the means testing side for the higher income brackets have been increasing at over 8% a year. So when you start thinking of today, that might be $450 for Part B, per month, exactly. In 9 years at 8%, it's going to be almost $1,000.
Right. And keep in mind, that's just Part B, which is kind of your basics.
That's right. So, and then another 18 years, now we're talking 2,000. So that's one of the ways that these premiums are increasing so much, is because of the inflation rate under the means tested Part B and Part D.
Yeah, and one thing to keep in mind, historically we're looking at 8%, but in the future it might be more. I mean, we have a problem with Medicare and with Social Security, and going forward, one of the solutions could be to just increase those premiums even more than they already have been. So one thing to take into consideration.
That's exactly right. And then the other factor, and we talked about this before, is Social Security. Those premiums all come out of your Social Security check. If down the road Social Security is means tested and you're getting less income, you as an individual may be writing a check to the government for your Medicare premiums outside of getting any Social Security. Yeah. And that's a real possibility, we think, for higher income earners. So just realize that $1 million, while it may seem, unlikely, the numbers that we look at in those inflation rates are real and have been occurring for some time. So we think that that's probably the number. And then the last piece of this that you want to be factoring in are taxes. So that when we look at $1 million, that's an after-tax number. So if you're not using tax-efficient investments or tools to pay for these costs, then it's not really $1 million. It could be $1.5 million or $2 million out of your 401k plan or your retirement plan that it's going to cost you to pay for these healthcare costs when you factor in the tax standpoint. And
exactly.
And I think with taxes forecast to have to go up at some point, this is only going to get worse and create bigger dollar amounts for having to pay for healthcare costs.
So while you may not be able to dodge these costs, they're going to be there. You're going to have to plan for them. The good news is if you use proper planning methods, you can save a lot on taxes in the long run on healthcare costs in retirement.
We have two tools if you are interested. We have a forecasting tool that will actually show what the cost for healthcare will be and how it will impact your Social Security. Mm-hmm. That's a tool that we provide at no cost. It just requires you to fill out a survey, and then it gets sent to you automatically. If you want to go down in the link below, we'll have a link to that survey where you can do that. And then secondly, we do have a full-blown report from Ivante. There is a charge for that, but we'll also provide a link below that you can use to take a look at that.
Yeah, and the first step is to, figure out what costs you're actually looking at. So go ahead and check out the links in the description below. If you do have any questions or you want to take a deeper dive, always let us know. Feel free to ask us questions in the comments below or contact us, again, if you want to go into a little bit of a deeper dive. We are Shannon and Michael, and we are always here to help. If you haven't already, make sure you subscribe to our channel and click the notification bell so you know when we come out with new videos.
Thank you.